Let's talk about bladder 40, middle of the crook, a 5-command point. Bladder 40 is located in the center of the popliteal crease between the tendons of the biceps femoris and semitendinosus muscles. How to find bladder 40? This point is best located with the patient's knee slightly flexed. Locate the center of the popliteal crease. A pulse may be palpable, and there, locate bladder 40. Located on the same level are bladder 39, which is one soon laterally, kidney 10, located more medially between the tendons of the semimembranosus and semitendinosus muscles, and liver 8, located more medially anterior to the tendons of the semimembranosus and semitendinosus muscles. Needling of bladder 40 is done vertically 0.5 to 1.5 soon. Caution, because we have the popliteal nerve, artery, and vein located deep to this point. Use moxa with caution, contraindicated according to some authors. To clear heat and eliminate stasis, we bleed the superficial veins, possibly followed by brief cupping. Caution, only used for excess conditions and in constitutionally robust patients. Bladder 40 is also indicated as a distal point for the lower back. Needle with the patient standing. For safety and balance, use a treatment couch or chair as a support for the hands, and ask them to move their lower back gently while manipulating the needle, with only short needle retention. When needling this point with the patient in a prone position, place a supporting roll or pillow under the ankles to relax the popliteal crease. Actions or indications of bladder 40: clears summer heat, stops vomiting and diarrhea, cools blood, benefits lower back and knees, opens the channel and luo vessels, alleviates pain. Special features: Husi point, earth point, lower Husi point of the bladder, Madanyang heavenly star point, Kawu command point of the lumbar region. Important distal point for the lower back, a point with a wide range of indications. Bladder 40 is a major acupuncture point. Also called equilibrium middle, it describes the effect of this point on the mind and spirit. When fear is scattering and disorientating the person, showing as nervousness, anxiety, and inability to settle, the steadier, deeper energy of the Husi point, together with centering and harmonizing effect of earth, helps the person contain and compose themselves and gather their thoughts and senses. Earth within the water brings stability. As a yang Husi point on the lower limb, it has an influence on its associated fu, the bladder. Because Husi points are situated where the command points end, they are seen as being a transitional state where external pathogens might enter more deeply into the body. Husi points present an opportunity, if pathogens have entered this far, to dislodge and expel them. They are indicated for diseases of the skin from pathogenic invasion. Because they are the most proximal of the transporting points, they affect the center of the body more than the far reaches of their meridian, which is affected by more distal points like the Jingwell points. The energy of Husi points is slower, deeper, and more stable than that of the more distal points. Husi points can be used to supplement or tonify qi as well. Bladder 40 clears heat and resolves damp from the bladder. It is applicable in urinary problems like painful urination, cloudy urine, blood in urine. Bladder 40 also clears heat from the blood and moves obstructions from the meridian, so used for blood stasis in the legs. It clears summer heat and so is used when someone has suffered an acute attack of heat leading to delirium, rash, or fever. As a Husi point affecting middle of the body and a point which moves qi and thus eases pain in the bladder meridian, it is a frequently used point for low back ache, chronic or acute. Although more frequently used in acute cases, and when the ache is on one or both sides of the spine rather than on the spine. As a local point, bladder 40 is a useful point for many knee disorders. It relaxes the sinews, benefits joints, and removes obstructions from the bladder meridian. Bladder 40 is the Husi point of the bladder channel and has long been considered one of the most important of the acupuncture points. According to Madanyang, the great physician of the Qin dynasty, bladder 40 is one of the 11 heavenly star points indicated for lumbar pain with inability to straighten up, severe lumbar pain that radiates up the back with pain and stiffness of the sinews and bones, wind painful obstruction that frequently recurs, and difficulty in stretching and bending the knee. The Ming Dynasty author Cao Wu, in the glorious anthology of acupuncture and Mox Sebastian, included it among his 4 command points, with a special action in the treatment of lumbar pain. Sun Simiao, in the 1,000 Ducat Formulas, says of bladder 40, pain of the lumbar region and spine that almost reaches the head. In any case of heaviness and pain of the lumbar region and leg, bleed this point. Bladder 40 is equally effective for acute or chronic lumbar pain, whatever the etiology, and for sciatic pain radiating down the bladder channel, and is an important point for atrophy disorder and painful obstruction of the lower limb. In the case of acute lumbar sprain, bladder 40 may either be needled or bled by the following method. The region of bladder 40 is examined on the affected side if the sprain is unilateral, and on both sides if bilateral. If dark and engorged blood vessels are seen at around the bladder 40 point, the patient is asked to stand, resting their hands on the couch. The blood vessels are slapped to further engorge them and promote the flow of blood, then wiped with alcohol and quickly pricked to induce bleeding.